So cancer of the prostate is a disease unique to men, as only males have a prostate. In the UK, about 1 in 8 patients will develop prostate cancer during their lifetime. There are about 48,000 new cases diagnosed every year, and there are about 12,000 men dying of prostate cancer every year. The unique thing about prostate cancer is that it often has no symptoms until the disease is advanced. Therefore, it is very important to test for prostate cancer, because that will help detect cancer early when the chances of treatment success are really high. Prostate cancer mainly affects men over 50, and your chances are increasing with age. The risk is even higher for Black men and men with a family history of prostate cancer. So there's no single test to diagnose prostate cancer. However, there are a few tests that your GP will do when a suspicion is raised about the possibility of a diagnosis of prostate cancer. These main tests include a digital rectal examination, as well as a prostate-specific antigen, PSA, so-called blood test. So the specialist will have a look at the test that your GP has organized, meaning the PSA level and the digital rectal examination results. We'll go through your overall health condition and also discuss with you the possibility and risks of prostate cancer. And then we'll have to discuss with you further detailed tests that will be recommended, meaning an MRI, magnetic resonance imaging scan, and possibly a prostate biopsy. So an MRI scan uses magnets to give us a picture, a detailed picture of your prostate and the surrounding tissues. So that MRI will give us clear details about the anatomy of your prostate, the size and the configuration of your prostate, as well as with information about the amount of water in your prostate cells and the blood flow, the level of suspicion of prostate growth in your gland. A recent trial across the UK called PROMISE trial has shown the effectiveness, tested and shown the effectiveness of multiparametric MRI. In around a third of the patients, the MRI is so convincingly negative that we can safely say that it is unlikely that these patients will have prostate cancer, and therefore this scan done before any other form of investigations will save them from any form of diagnosis or unnecessary treatment. And if a biopsy is required, the abnormal area found on an MRI can be easily targeted with dedicated transperineal prostate biopsies. So the limitations of the old-time conventional transrectal prostate biopsies, meaning the lack of access to the anterior part of the prostate, as well as the risk of infections with these biopsies, have led us urological surgeons to use transperineal prostate biopsies nowadays. So these biopsies happen with an ultrasound probe through the back passage that will give us information about the anatomy and the configuration of the prostate. But the access to take biopsies from the prostate happens through the perineum, the part of the body that is in between the back passage and the testis of the male patients. That allows us to target the whole of the prostate, including the areas that were difficult to access before with the transrectal biopsies. And the needles do not go through the back passage, therefore the risk of infection is virtually none. So the suspicious areas detected by the MRI scan are targeted, and the way to target that is by overlaying the images of the MRI on the real-time ultrasound images that we use to guide our biopsies. In a bit more further detail, so the MRI is very useful to tell us the suspicion of prostate cancer, but is not easy to help us taking biopsies through the MRI scanner at the same time. And therefore, the urologists are used to manipulate the ultrasound through the back passage in order to guide their biopsies. And unfortunately, the ultrasound is very good in telling us information about where the prostate is sitting and how the prostate is looking, but not giving us information about the suspicion of cancer. By overlaying the images of the MRI to the ultrasound, we gain pinpoint accuracy in targeting the areas of concern and also mapping the rest of the prostate at the time of the biopsies. The benefit of these biopsies over the transrectal biopsies are, of course, the limited number of biopsies needed to be taken in order to target the areas of concern as well as the rest of the prostate. And secondly, the experience of the patients, given the fact that the number of biopsies are limited, and therefore this can happen either under general or even under local anesthetic with safety and quite good efficacy in finding the answers or giving the patient the answers that we need to give. So these biopsies are done either under local or under general anesthetic. So the usual preparation for a small procedure in the hospital that lasts something between 20 minutes and half an hour. So if it is to be done under general anesthetic, the usual preparation for general anesthetic, but no specific preparation as such, apart from the fact that you need to spend some time in the hospital to have the procedure and then recover quickly from that and get ready to go back home and your regular activities.